Non-intestinal parasites are those that host themselves in the intestinal tract of the human body. There are two types of intestinal parasites, helminths and protozoa. Helminths are the worm-like structures and are large enough to be seen in the microscope, whereas protozoas are one-cell organisms. Intestinal parasites are often transmitted by contaminated food and water and can also be transmitted by close intimate contact. Intestinal parasites are most commonly found in places with poor sanitation and hygiene. Intestinal parasites are spread when fecal matter gets into the mouth. This can happen by contaminated food and water or by oral and anal sex play and can even occur from diaper changing. This is why it is very important to wash your hands. Two major ways to prevent the spread of intestinal parasites. The first way is by practicing proper hygiene. Hand washing is the key with this disease. The second way to prevent the spread of intestinal parasites is by using a dental dam or a piece of plastic wrap during anal or oral sex. Can do tests to see if you have intestinal parasite symptoms. A healthcare provider will examine your stool and help you get any treatment that you may need. There are no symptoms for the intestinal parasite. When symptoms do appear, they are diarrhea, abdominal pain, bloating, and nausea or vomiting. That 2.5 million people suffer from intestinal parasites and that 1.6 million people die from a parasite infection around the world. It is estimated that more than 80% of the population has parasites. Parasitic drugs are usually effective against intestinal parasites. The drug regimen should be followed accordingly. It is important to understand that intestinal parasites may be treated but can also reoccur if the source of the infection is still present in the environment. Public service announcement. I hope that you learned that if you do not do this, get